with urgent care, I mean, it's kind of like the bridge between primary care and the emergency room.
Yeah.
And let's be honest, nowadays, patients are having a really hard time getting in to see their primary care where they
Hmm.
need to when they need to get seen. And then a lot of times people are either using like telehealth or they're calling like their insurance nurse hotline. And these people are getting the recommendation of like, hey, you need to be seen. Please go to an urgent care.
Well, hey there, it's Liz Rohr from Real World NP, and you are watching the Real World NP YouTube channel. We make weekly episodes to help save you time, frustration, and help you take the best care of your patients. Hey there. This episode is an interview with Michelle Liu, who is a nurse practitioner in urgent care. I love specialist interviews because what I really hope for the healthcare profession and for nurse practitioners who are practicing in it is that we are better connected between the silos of primary care and all the different specialties. So we understand what they understand what we do, and how do we communicate and connect better so that we're taking the best care of our patients. So in this interview, I talked with Michelle. She actually had the unique perspective of working first in primary care, then transferring to urgent care, and actually going back to primary care because she wasn't sure if that was right for her. And now she's back in urgent care, which is beautiful. In this interview, we talked about what she loves about it, what her kind of day to day is like. What she wishes primary care providers knew, especially from that perspective of practicing herself in primary care. We talked about when nurse practitioners or clinicians would like to get into urgent care, what are some of the things to consider, whether you're a new grad or you're an experienced provider and you're thinking about that career change. We talked about general kind of pearls of practice and wisdom to share from an experienced urgent care provider to whether you're a new grad or again considering going back into urgent care or going to urgent care for the first time. So I hope you enjoy this interview. I had a really fun time recording it. Without further ado, here is my little chat here with Michelle Liu. Oh gosh, thank you so much for being here. Can you introduce yourself to the people?
Yeah, well, first off, Liz, thank you so much for having me on here. My name is Michelle, and I am a board certified family nurse practitioner. I graduated from Gonzaga University with my master's back in 2014. So I've been practicing now for almost 10 years, and the majority of the time has been in urgent care. Prior to becoming a nurse practitioner, I was a perioperative nurse. I started out in aesthetics and plastic surgery, and then moved to ortho and general surgery. And then I also did a small stint as a contract nurse in the GI lab, which was really fun. As a nurse practitioner, I started out in community health, and then I went to urgent care. I thought I missed primary care while I was in urgent care. I think I just missed managing the chronic conditions and really developing these relationships with my patient. So I actually went back into primary care for a couple of years and realized that I actually enjoy urgent care a lot more. So
I
I
love
went
that.
back and I've been back ever since.
I love that.
On a more personal note, I am also a mom to three amazing young kids. They're 3, 6, and 9, so they keep me quite busy. I don't really have any hobbies because of that, but I do like naps. So whenever possible, I'll try to sneak in a
Yes,
nap when
the
I
ultimate
can.
hobby.
Right? Yeah. I love food. I'm a big boba fan. Yeah. I grew up internalizing a lot of like the struggles that I was going through when I was in nursing school or grad school as a new grad and all of that stuff. And so I have an Instagram account where I share a lot of it. I think, back then that ideology that I had where if I shared any of my weaknesses, it made me less of a person. And now that I'm older, I realize how faulty that thinking was on my part. And so I really encourage people just to kind of like talk about what they're going through because I can almost guarantee whatever you're feeling right now, whatever you're going through, someone has gone through it or someone else is going through it. And just being able to make that connection and talk about it is it's game changing.
I love that. And that's how I connected with you is through Instagram. I feel like your stuff is
Yeah.
just so relatable and It's
Thank
awesome. So thank you so
you.
much for sharing all of that. And thank you for sharing your story and your background because I think that it's really permission giving for people to hear the different journeys that people have. I think especially in my work with newer grads, people go through school and have this conception of what they think that they want. I think we all
Yeah.
kind of do whenever whatever whether it's nurse practitioner or another profession. And then
Oh,
once
yeah.
you kind of get out there, it's like figuring out what I like and what I don't like and giving yourself that permission of like, you know what, I miss primary care. Oh wait, no, I don't. I'm actually really happy in urgent care. Like that's just so wonderful
Yeah.
to hear.
Yeah. I mean, I think I'm pretty indecisive. And so I like to have options. I don't
Yeah.
necessarily think I will go with those options, but I find that, the more options that I have, like the more I'm gonna thrive because
Yeah.
I know I can do it if I want to. So yeah.
Absolutely. And it's just I think especially I don't know if this is post COVID, but that's what it feels like or quote unquote post COVID. Like people just kind of there's this conception of like you have to, you went to school for this thing and you have to do this thing and you have to do it this way. It's like, no, we don't have to do that anymore. We don't have to. We can change our mind. You're allowed to change your mind.
No. And especially when it comes to like nursing, like it's
Yeah.
so flexible. And I always knew nursing was flexible, but I mean, the more that like the more that I stay in this career, like the longer I see like just how really, really flexible it is. And I think I never quite grasped that concept when I was younger.
I love that. So one of the things I want to touch on next is when we were chatting before we recorded, when we first chatted, I just felt like you really lit up when you were talking about how much you like your job. So can you
Yeah.
tell us, like, can you
Yes.
tell the people like that light and that magic and that joy? I think is so important to share when things get, especially in this profession, when things can feel really heavy. So like, what is your job and what do you love about it?
Yeah, so I work in urgent care and I love urgent care so much and I think it fits my personality. Again, it goes back to like, I have all this option because I see so many things. I see a variety of conditions. I get to do procedures. Every day is a little bit different. You never know what comes through the door. And there are some days where, it's not as busy. And then there are days when I am just like, I'm running around like crazy. And to me, it's fun. It makes the day go by faster. And the impact that I have on my patients, I know for the most part, it's usually a positive one.
Mhm.
And for me, it's such a rewarding experience. So the particular urgent care area that I work in, I feel like it's a little bit different than your traditional urgent care where people walk in, they're like, okay, you're number three in line, and you might have to wait 20 minutes, you might have to wait 2 hours.
Yeah.
In my current practice right now, we have kind of like this newer model where it's appointment based. So even if you walk in, we'll give you the next available appointment. And for me, I think it's such a great model because people know exactly how long they're going to have to wait until they're seen, as opposed to just sitting there and not really knowing like
Yeah.
when you're actually going to be seen. And then I
Yeah.
also like that approach because as a nurse practitioner, I know what my schedule is going to look like. I know that I don't have 10 people out there in the waiting room. For me, I get anxiety when I know that people are waiting for me,
Yeah.
and the more people that are waiting,
It just
the
like
more
keeps piling
anxiety.
up and you're like,
I
oh my
know.
gosh.
Yeah. And so I love this a lot. I also love the organization that I work with right now. They very much care about us. They make sure that, we get our breaks. They make sure that if we're seeing a whole bunch of patients, we have the appropriate resources that we need to provide safe and effective patient care. And also, just my work life balance in general is amazing. I work 3.5 days, and on the days that I'm not working, I'm not thinking about work. I can do whatever I want and not have to worry that there's something going on with a patient that I saw, during my last shift that I need to follow up with right away. Otherwise, I'm gonna miss something important.
Absolutely. Absolutely. And I want to in our time I want to talk about how do we connect how do we better connect or best connect urgent care and primary care? Like I feel like there's definitely like a lack of understanding between the different it's just so siloed. So I want to get to that, but first I can hear the people asking. There are so many people I think that are interested in getting into urgent care and they're really intimidated.
Yeah.
And so I can just hear the questions of like what kind of training did you like if you're in primary care, how long
Mhm.
did you wait in primary care before going to urgent care? Just your experience, not that that's the gold standard necessarily, right? But how much experience and like what were the things that you did to get there? Like, did you do any special trainings? Like,
Yeah.
how did you know you would be ready to do urgent care?
Yeah, yeah. I think anyone can start out in urgent care. I think urgent care is fine for new grads. There are definitely certain criterias that I think you should look out for if you are a new grad to make sure that you'll actually succeed in new grad in urgent care. With urgent care, I mean, it's kind of like the bridge between primary care and the emergency room.
Yeah.
And let's be honest, nowadays, patients are having a really hard time getting in to see their primary care where they
Hmm.
need to when they need to get seen. And then a lot of times people are either using like telehealth or they're calling like their insurance nurse hotline. And these people are getting the recommendation of like, hey, you need to be seen. Please go to an urgent care. And so in terms of, addressing your first question, kind of like the disconnect between urgent care and primary care and what I would like primary care to know, and I guess maybe a little bit for patients to know too, is that we don't always necessarily know or have access to your medical records. I
Yeah. I
Yeah,
was going to say before you get further into that, I think one of the frustrations that, I mean, you know this because you were in primary care as well, but I think a lot of
yeah,
people are just like, oh, urgent care, like, why did they do that thing? So I
yeah,
think that so continue on. I just want to like name that there's that thought there sometimes for primary
yeah.
care. So I'd love to bridge this gap here. So go ahead.
Yeah. I mean, I work in like a standalone urgent care clinic. And so we're not affiliated with any, major healthcare organization around my area. And we also don't have access to their health records. And so a lot of times I get patients who come in and they're like, oh, can you just look it up on my chart? And
Like, no.
it's spending that 30 seconds and educating them like, you know what? Unfortunately, we don't have like a universal electronic medical record at this time. So I can't.
Yeah.
And patients sometimes I don't think are as aware of like how detailed their medical records are.
Yeah.
So even when I go through a history and I'll ask a patient, hey, do you have any medical conditions that I should be aware of? Right? They'll say no. But then I go to like their medication section and I'm like, are you currently taking any medications right now? And,
There's like
they're
20.
telling, yeah, they're like, I'm taking Losartan, I'm taking Lipitor, I'm taking metformin. And then I ask them, like, oh, are you taking these questions or are you taking these medications because you have high blood pressure? And they're like, yes, but they failed to mention that when I asked them. So I
Yeah.
definitely think there's that disconnect. And so, yeah, in urgent care, we don't have the same access as primary care do. And so what we're doing in that short amount of time that we have is really to like the best of our abilities. Um, I also think sometimes urgent care gets a really bad rep of just dispensing antibiotics and
Yeah.
steroids like it's
Yeah.
candy. But
Hmm.
again, that's not necessarily the case. I think in urgent care, we do see a higher volume of people who may need antibiotics because they're just able to get in to see us sooner.
Yeah.
And so, I think we may dispense more, but I don't necessarily think it's like inappropriate in how we dispense it. And so I think we get that kind of a bad rep, but I want to say it's not true.
Yeah, absolutely. And I guess to focus on this for a second, like when people I think one of the things with primary care that feels like a mystery, like I know that I struggle with this because I haven't worked in urgent care or the ER. And like there, especially like having a couple of years of experience at this point, I know which ones need to go to the ER specifically, right? But I think sometimes there's a little bit of a gray lot, like a gray area of like, is this appropriate for urgent care or not?
Yeah.
And I think I would just love to hear your thoughts about that. I think acknowledging that there are different kinds of urgent care with different types of facilities and equipment. Like I had to bring a family member a couple weeks back, and I was like, I don't know if they're going to do IV fluids. I don't know if they have X-ray there. Like we're just going to have to see on a personal side, but on the clinician referral side, I would love to hear your thoughts about that. Like, are there things that you're like, yes, urgent care, or absolutely stop sending these to urgent care because we don't have capacity for that? I don't know. What are your thoughts on that?
No, I totally agree with you that every urgent care is also very, very different and there's different acuities to them. Like some urgent cares, they have CT. in
Oh,
them.
wow.
They have X-ray, they have EKG, they have CT. These urgent cares are usually ones that are associated with like bigger health organization, and I think usually they're the ones that are like right across from their emergency department. So they have a lot of resources. And then you have like some smaller standalone urgent cares where, they don't have EKGs. They
Oh,
they might
wow.
might not have X-ray.
Mhm.
And so there's such a range in them. And I think one thing that a patient can do is they can always call and ask. That way, you're not wasting your time going there and then being redirected to somewhere else. I think when someone comes into my urgent care and we don't have that resource, we let them know, and then we do recommend close by areas who are able to provide that service for them. But it's really hard, and I think as a clinician, unless you know this urgent care, you know what they have, you don't really know.
Yeah.
You don't really know the resources that these urgent care have, or you don't really know the resources that these urgent cares will have to kind of like serve your patients.
Totally. In general, though, I guess are there specific diagnoses that you're like, I don't know if there's any hard and fast rules, but there any specific either chief complaints or situations where you kind of like have to refer over and over again, actually refer them to the ER instead? Like, I'm so sorry you came here to urgent care, but I actually need to go to the ER. Like, are there any of those kind of scenarios for you?
Yeah. Um, there there are. The way that I practice is a little bit different. I mean, if someone is acutely ill looking, if they are just pale and they're, just, humped over and, they're just throwing up nonstop, those people, just because their acuity, like their symptoms are so severe, urgent care most likely won't have the resources to help them stabilize at that moment, even if their condition isn't, like a medical emergency, because they look and they sound so bad. Like we're very limited on what we can do and what we can offer. At the same time, people present with different conditions very, very differently. A medical emergency that I think everyone knows is like appendicitis, for
Yeah.
example. So I think you're more, I wouldn't say traditional, but I think, if a patient comes over, yeah, if they're hunched over, they're hugging their lower abdomen, they're pale and they're like so nauseated. You think, yeah, that's the look of appendicitis right there. But I've also had patients who've come in and they walk into the clinic perfectly fine, and they're like, yeah, I have a little bit of nausea, but I think I just ate something from the food truck last night that's causing me to have this symptom. And then when you go do the physical exam, you're like, oh my gosh, you have rebound tenderness, you're tender at Bernese point, you're tachycardic. I'm actually really worried that this could be appendicitis. Um, and so I think if you ask people, they might say something, they might have a different opinion. But for me, I think if there's a patient that sounds acutely ill, the emergency room is kind of like their best resources, because there's again not that much that we can do in urgent care to really like stabilize them at that moment. um but for me in practice anyways, I'll see anyone, and usually within like the first 5 to 10 minutes or so, like I'll know if they need to go to a higher level of care or not.
Yeah, definitely. Yeah, and I think I'm primarily like thinking about it sounds it's hard to say. Like, I think there are people that get referred to urgent care from the clinic, but also like telemedicine. Like if you have a
Yeah,
telemedicine visit or like an on-call call
yeah,
type of thing.
yeah,
That's helpful to know. And I think it sounds like it's also the patients who need ongoing monitoring. Like if you're worried about them further destabilizing, you probably don't have the staff to like monitor them and make sure that they're not getting worse in that kind of way. So
yeah,
hopefully that can help
yeah.
people.
And I think if you asked me this question like 5 years ago, I would tell you anyone with chest pain, like please send them to the emergency room. Like,
Yeah.
anyone with like right lower right lower abdominal pain, send them to the emergency room. But everyone just presents so differently that, unless they're acutely ill, it's
Yeah.
kind of hard to tell until you actually get in there and you talk to them and you do an assessment.
Yeah. Totally. So are there other things that you'd love to share with primary care aside from like kind of a little bit of grace on the like steroids and antibiotics and needing to prescribe without any history kind of thing, without any like medical records, any other things that would be helpful for them to hear about how to best work together.
Yeah, I think one of the hopes that I have in the future for urgent care and primary care is that we find a way that we find a way to, I guess, almost have like a better partnership
Yeah,
because
absolutely.
again, it's so hard for patients to come in to their primary care provider when they have an acute illness. And even if I see them in urgent care and I'm like, okay, let's say you have pneumonia, I would like for you to follow up with your primary care provider in a week just to make sure everything is okay because you always want to make sure you close that gap in terms
Yeah,
of like patient care. But the honest truth is there's a really good chance they probably won't be able to get in to see their primary care in a week. And so most
yeah,
likely they're going to come back and see me.
yeah,
Um, and so I, I, I wish we can have like a partnership or like
yeah,
something
yeah,
where where we can almost like go hand in hand with patient care because I feel like the future of medicine is like you have your primary care provider who's going to manage your chronic conditions that are relatively stable-ish. I think primary care providers are really great at preventative medication or preventative medicine, making sure that you stay healthy. But just with how healthcare is going, I don't see how it's going to be possible for patients to get in to see their primary care provider when they're sick. And so
yeah.
I'm hoping to have like some kind of like a better partnership.
Totally, totally. And I feel like I think a lot about the healthcare system and like how we can do this better and like how there's individuals and then there's systems. And
Yeah.
it's so hard sometimes being an individual in a system that needs work. But I think one thing that occurs to me as you're saying that is like, and I actually talked about this on another interview recently, is cold calls is something that I was introduced to. I don't know if that's an actual name that other people know, but that's what we call it, is like when you do a cold call to a specialist and it's like you develop a relationship with that specialist so that
Yeah.
when you refer to them, it's like you can ask a quick question about a patient that you mutually see. It almost feels like that might be a good way for people to think about urgent care as well. Like, what are the urgent cares that are available in this area? And it's almost like, could you consider having that conversation with your patient in primary care of like, what is your quote unquote urgent care home? And could you
Yeah.
try to use that one, right? People travel and stuff, but it's like,
Yeah.
that would be really nice. But then the other thing you said about the fact that you don't have medical records, it reminds me of like when the power used to go out, or the system, the EHR used to go down in primary care and one of the clinics I worked at. And then you'd see patients and it would be dependent on what they knew because you
Yeah.
didn't have records. And it's like, oh, wow, that's really hard.
Yeah.
And there's so much to address in primary care, but just putting a kind of like a bug in the ear of people of thinking about that of like, what would it be like if you were to conduct a visit without records? Like,
Yeah.
does your patient understand what their medicines are, why they're there in the first place? They're like,
Yeah.
I don't know. I'm just following up. I'm like, okay, well, I'm glad you're here and I want to take care of you, but I don't have any information. So, but
Yeah, no,
yeah,
exactly. Yeah, that's exactly right. Yeah. I mean, even though we don't have a lot of access to patients' medical records, but I'm when our medical record system goes down, it's like the apocalypse.
yeah, it's really hard. It's really hard. So I'd love to hear from you. I guess a couple of things. So I can again hear the people wanting to who are interested in urgent care. What are some of the things that you see in a day? I mean, I know that's kind of hard to recall, probably. I don't know if it's like sometimes when I leave clinic, I'm just like, what did I do today? I don't remember any of it. But
Yeah.
could you give some examples of things? Because I think it's really intimidating for people. Like, how different is it from primary care in terms of the patients that you see and the procedures that you
Yeah.
see and things like that?
Yeah. I mean, having experience in primary care, honestly, it's not that different. With urgent care, we are seeing more acute stuff. So the bread and butter of urgent care is really your ear, nose, throat, respiratory infection. So your strep throat, your ear infection, sinusitis, bronchitis, colds, flus, things like that. We also see a lot of like UTIs, for example, a lot of musculoskeletal injury. So someone is playing soccer and they twisted their ankle, or someone bent over and sprained their back. Um, we also do a lot of like workers' comp too in my urgent care in particular. And then I do procedures like laceration repairs. I drain abscesses. Sometimes we'll do like a skin biopsy or removal. So it's a really good mixture of seeing patients and then getting to do procedures. And I will say, when I was in primary care, I hardly had any opportunities to do any procedures at all
Yeah,
whatsoever. And coming from a perioperative background, like I love procedures. I love doing things
I
with
do
my
too. They're
hands.
so fun.
And so yeah, so it's really fun. I think my favorite procedure to do is just like suturing. Like
Yeah,
I just love suturing.
that's
Um,
awesome.
but yeah, but and then I mean a typical day in urgent care, again, it's kind of hard to say because every day is so different. We do have, I think, just kind of like primary care, we have like waves of things. So in the fall and early winter, that's kind of like our peak respiratory season. So we'll see a lot more colds and flus than anything else. In the summertime, typically we see more musculoskeletal injuries because people are out and about doing things outdoor, and then they can get hurt, and then we see them. And then I think like right before school starts, we see a lot of like sports physicals, for example. And then the first couple of months of the year, I think it's a little bit more relaxed compared to the rest of the year. And I think that's kind of like a normal trend in like all specialties across healthcare, where the first couple
Totally.
of months of the new year, it's a little bit more relaxed.
Totally.
And then for my urgent care, I mean, I think on average, I probably see about 18 to 20 patients a day. I get really relaxed days where I see like maybe 12, and then I can have really busy days where I'm seeing like 20 patients.
I'm sorry, I cut out for a second. The busy days, you say usually 20 patients?
28.
28. Okay. And so how does your schedule work? Like and when you went into like an interview and stuff, like is it 15-minute visits? Do you have a set kind of schedule bracket? Do you get longer for procedures? Like how does that work?
Yeah. So, because my urgent care is appointment based, most of our appointments are 15 minutes based. We do have certain appointments where we'll try to make it a 30-minute if possible. So, for example, if I think I'll have to do like a pelvic exam, for example, that would be a 30-minute visit. If I have something that might be a little bit more involved, we do have that option of changing it to a 30-minute appointment, and that does include all procedures as well. When I first joined this company, I they made all of their appointments 15 minutes regardless.
Yeah.
But a lot of us, voice our concern like, hey, we actually don't have enough time. And with the particular organization that I work with, they really want to emphasize on like their timeliness and making sure that patients get seen
Yeah.
when they're scheduled to be seen. So they kind of took that into consideration. And so now we are allowed like 30-minute appointments um, on certain concerns.
Oh, that's great. And then when you have those 28 patient days, it's just kind of like a by discretion overbook type of thing, or how does that
Yeah,
work?
pretty much. It's pretty
Yeah,
much, we're just slam, and we're there to help people, right? And so we do what we can to try to like squeeze the
totally.
people that we're able to see in.
Yeah. And how did you learn the procedures that you learned, like suturing and things like that? Like, did you learn it on the job? Did you do like trainings or anything like that?
Yeah. So in terms of like suturing, again, because I was a perioperative nurse, when I worked in aesthetics and plastic surgery as an RN, I worked under an amazing surgeon, and she taught me how to suture. I was actually
Oh,
her first assist.
oh my
And so
gosh.
that was like a wonderful wealth of knowledge that I'm so incredibly grateful for.
I love that.
And then when I transitioned to primary care, and then I did some of these other procedures that I wasn't too familiar with, like for example, splinting.
Yeah.
I did a lot of like splinting. My job offered like a hands-on skill lab
Nice.
every couple of times throughout the year. And so anything that we felt deficient in, we can just go to the skills lab and kind of just brush up on our skills. So it
Totally.
was training that my current workplace offered.
That's awesome. And then you mentioned that you did orthopedics as a nurse as well.
Yeah.
'Cause I think that
So
people really struggle with musculoskeletal ortho things.
yeah.
So I think that's just like I'm hearing that question too. Any like, how did you get more comfortable with that topic?
So when I said ortho, I did more like ortho surgery as
Oh,
opposed
I
to like
see.
ortho clinic.
I see. I see.
Yeah, but again, it really it's just more like exposure, because
Yeah.
even in primary care, especially when you're first starting out and you don't have that huge patient panel, you kind of are like a walking clinic. And so you start seeing people more for like acute
Yeah.
illnesses. And so that exposure and just experience.
Awesome. Beautiful. Cool. Well, thank you so much. Are there other kind of like pearls of practice or pieces of wisdom you want to impart to the primary care people?
Yeah, well, um, I don't know if this is specifically just for primary care. I think this
Totally.
could be like for everyone. I think one of the things that I would, recommend or say take to heart is like number one, if you're really interested in urgent care, go for it.
Yeah.
Go for it. Whether you're a new grad or if you are in a different specialty and or even in primary care and you want to go to urgent care, everything that you've learned, everything that you've experienced will help you in urgent care because we see so many things, we see so many varieties. Um, you're going to see it. You're going to use that knowledge in urgent care. So don't ever go into something saying, like, oh, I'm just wasting time here until I can get into urgent care, because
Yeah.
that's not true. Whatever you learn is going to be so valuable. And then the other thing, too, is like if you are a new grad and you are interested in urgent care, I really recommend looking at the places where you want to work. Make sure that you're working with another provider. And I think that's one of like the biggest recommendation and advice that I have for new grad who wants to work in urgent care is you have to work with someone. Urgent care is very urgent care is very fast paced. And I remember like as a new grad, like I was scared. I was so overwhelmed. I had like
Hmm.
imposter syndrome, and working in urgent care where you're by yourself and you're
Yeah.
having all these patients, it's very overwhelming. You're not setting yourself up for success. You're going to get burnt out. So work with another provider. That way, if you have any questions, you can just ask them. They're right there in the clinic for you. And then number two, make sure that you talk to them about having a ramp up program and
Yeah.
get it in writing. I think one of the things that sometimes people can encounter in urgent care is that their employer will say, "Yeah, you'll get a train you'll train with someone for like 4 weeks, before we have you go solo." But really, you're only training with someone for 2 weeks,
Yeah.
and then let's say they're short staffed and they have to pull this other person, and then you're kind of just there all by yourself. And it's a very much sink or swim situation. And
Yeah.
it's not the best environment. And I don't recommend that at all. So get it in writing, make sure you have proper training, make sure you get a mentor if possible. I think having a mentor is such an important component to being successful in your career.
Absolutely. I cannot emphasize everything that you just said so much. I
Yeah.
guess I'm wondering two different things. One is like if you're interviewing either a new grad or somebody who's transferring from another specialty,
Yeah.
what are the things that you're looking for? Like what are the I don't know if you participate in interviews, but like what are the things that you've noticed about candidates that it's like, oh, that's not a great
Yeah.
match, or that is a great match,
Yeah.
especially somebody who
So
doesn't have experience.
Yeah. So, one of the most important skills to have in urgent care is being able to tell if a patient is sick or not sick. And basically, what that means is this patient stable enough to have outpatient management, or do you need to escalate this person to a higher level of care? And usually that's the emergency room. Um, Usually, with interviews, you're going to get case scenarios, and we want to see what your thought process is like. And
Yeah.
so, if you get a patient who comes in and let's say they have really abnormal vital signs, but they look stable,
Yeah.
what do you do?
Yeah.
Again, everyone presents so differently. So, really learning, just red flags, like major overall red flags to watch out for. I think that's a really important skill, and I think that can definitely set you apart from other candidates that are applying because you have this amazing skill of being able to tell, is this person sick? Are they not sick? And I can't emphasize how important that is.
Absolutely. And I love what you said about we want to know what your thought process is, because I think when I've
Yeah,
talked to new grads and even experienced people looking for a new job, it's like they're so focused on what the quote unquote right answer is. And
yeah,
actually like there are safe answers and there are unsafe answers, right? When,
yeah,
even with patient care, but it's in that interview process, it's like we don't know what you know, and that's a way
Yeah.
to like walk through like, oh no, oh, okay, I see where they're going with this. It's like they're going on the safety track, they're going on the red flags track. Like I can see versus like I think I would just ask somebody, which is great. Like you can ask people, but
Yeah.
like you also have to think through the process and like
Yeah.
demonstrate what the process is. And it's nerve-wracking in interviews, but it's nice to share that.
Yeah, for sure. And to your the comment of, if someone were to say, I would ask somebody, I think that's perfectly
Yeah,
fine too. I know interviews are very scary, and even when I go on interviews now, I get very, very nervous.
totally.
But it's really just we want to know what you're thinking. And one of I think a big strength that a person can have is knowing what you don't know.
Yeah,
And to say, I don't really know, I would go ask somebody. And if, maybe it came back this way, then I would do this. And if it was
yeah.
this way, then I would do this. And then I also think, too, the way that we practice is very dependent on our environment. So
Hmm.
if you come from an area where, have you don't have a lot of resources. Let's say you don't have like on-site labs. Your
Yeah,
answer may change. You may say,
yeah,
I would send this person because I don't have access to it.
yeah,
Whereas if you worked in an area where you had so many resources and you're like, yeah, I would order a troponin, I would order a D dimer right there,
yeah,
the fact, and I think just verbalizing like, oh, hey, I come from a clinic where I don't have this, so that's why I would send them for this exact purpose.
yeah,
So just giving a lot of information, talking about your thought process. There isn't necessarily like a wrong answer per se. We
yeah.
just really want to get to know you and how you think.
Yeah, totally. I love that. And then my last question is what are some do you have any urgent care resources that you recommend that either you enjoy or your
Yeah.
colleagues enjoy, especially for somebody who's like, I still want to prepare more before I go into urgent care? Like what are the, sites or books or podcasts or anything like that?
Yeah, for sure. So there's a couple on the top of my head. Hippo Education,
Oh
they have
yeah.
urgent care boot camp that I absolutely love. It's very detailed, it's very comprehensive. And the style too is very relaxed. It's kind of like you're having a conversation
I
as
love that.
opposed to like a lecture. So I think they present it very, very well. And so Hippo Ed has an amazing course. So I usually will
Awesome.
recommend that. Um,
Awesome.
I also have like small little resources for other stuff too. Like, for example, in urgent care, sometimes we have to order, advanced imaging, whether it's like an ultrasound, CT, MRI, depending on a certain area. And I have a link to this PDF. It's in my urgent care resources on my Instagram.
Oh,
But
beautiful.
but it's an amazing resource where, you can look up what is going on and then it'll
Yeah.
tell you
Which
exactly
imaging?
what type of imaging
Beautiful.
you need. And that has saved me so many times because I'll be honest, sometimes I don't really understand the difference between ordering something with contrast and without
Totally.
contrast.
Totally. Totally.
And yeah, and then EKG,
Yeah.
cardiology made easy.
Oh, yes.
She
I
has an
need to have
Instagram
her on
page.
the podcast. Absolutely. Go ahead.
Yeah, Jen is amazing.
Yeah.
Again, I love, like I'm a simpleton, and so I love it when I read something or I'm learning something and they break it down really simple. So I'm like, oh, yeah, that makes so much sense because EKGs are very, very intimidating to me.
Yeah. Oh,
The way that-
absolutely.
Yeah. And then the way that Jen breaks it down is just amazing. So that's another resource that I have. And if anyone who's listening to this and are interested in learning a little bit about EKG, she does have like free classes that you can do every once in
Yeah.
a while. And I did that first. And again, it was still a lot of information that I learned just from those free classes. So
Yeah.
that's another resource that I would recommend.
Beautiful. And I'll make sure that these are all in the show notes. And I'll definitely link to your urgent care resources on your Instagram.
Awesome.
Yeah. And so where can people find you? And do you want to share a little bit about something else you're working on?
Yes, for sure. So, like I mentioned, if anyone is wanting to connect or if anyone has any questions about urgent care, you can definitely find me on Instagram at my handle is the.np.mom. I love being a nurse practitioner and I'm very passionate about this career. And one of my latest projects is that I wrote a children's book introducing little kids to nurse practitioners that I'm very, very proud of.
I'm so excited.
I I love our profession so much, and I wish more people would know our profession and know what really nurse practitioners are. And so I figured with this children's book, hopefully we can educate the next generation, and who knows, maybe educate their adults in the process of what
Yeah,
our profession is.
absolutely.
So if anyone is interested, you can find my book on Amazon. It's called My Mom Helps People Feel Better.
Oh my God. I didn't know that was the
And
title. That's so sweet.
and it the story is told by my oldest daughter's point of view.
That's
And
so sweet.
there's a photo of like my other kids and like my husband in it. And my kids are so proud of the book. And
So
it's
cute.
so amazing. It's such a great project.
I love that. I love that. We'll be sure to share that too. That's awesome.
Thank you.
Congratulations. Book writing is not easy. So,
Thank
acknowledgments
you.
for that.
Thank
Cool. Well,
you.
thank you so much for being here. This is really, really special. And I think that people are going to get so much out of it. So, thank you.
I also thank you so much again, Liz.
Of course.